Hello, dear aquarists. Welcome again to one of my cases of fish diseases. Today, 209 about the silver shark, Balantiocheilus melanopterus, which were having a bacterial infection. And you could see that in the aquaria when the fish were becoming very skinny and, how can I say, wasting away. And we might have found also a parasitic infection like a Sporozoa infection. You can get details on fish diseases, treatments and prevention in my books on fish diseases. And here we see a picture of the aquarium with the skinny silver shark. Here is one and here is one. And some are still having a full healthy body. And the other ones, well, getting weaker and skinny, and some were dying. And here we see one of those skinny ones. You see how the behavior is getting poor, not so active. You can imagine also will have a little chance of eating very well and be out competed by the stronger ones in the aquarium. So our examination showed us that the gills had an infection of bacteria, a gill rot. Look, these lamellae are all gone, so the function of this gill is very poor. And here it's even advanced, so it's a big hole in the gill tissue. Well, this is a serious infection. And at the same time, we found inside in the organs bloody red liver and a lot of melanomacrophage centers in the spleen. And here we see also parts of the organs which have black parts. Well, this means that organs were, how can I say, infected, or something was troubling it. And what we found was interesting in the liver. We saw those bacterial colonies here, all those black parts on the liver here, and the side of the liver is a bacterial colony. And here I show it in a 400 magnification. You see the tiny black particles, which are bacteria. And here is the colony. All those black parts are colonies. So millions of bacteria and causing necrotic tissue, causing well, very unhealthy conditions because it's a bacterial infection. We also found in other parts in the abdominal cavity of the fish a lot of a rot type of bacteria. So this was another kind of bacteria. So at least we could identify two different types of bacteria. And in many cases, bacterial infections are occurring with many different types of bacteria, usually 2, 3 to 4 different types of bacteria at the same time infecting the fish. What was interesting to find some parasites here in the gallbladder. We go bigger magnification, 400. We see this kind of Sporozoa parasites sitting here. We could not identify. You need sometimes a higher magnification, but at least this was also maybe the case where the fish was troubled, and because the gallbladder had hardly any green fluid anymore, so it seems to be troubled. So what we could conclude that, well, that the fish are too much damaged, the skinny ones, and that makes it difficult to cure. You might have to treat with a good antibiotic. You can ask advice from your veterinarian or the fish doctor. Maybe here oxytetracycline or furaltadone can help. I have details on that in my book. The problem is you never know exactly how the bacteria will respond unless you do a lab culture or you do a culture on the bacteria and you checked if they are resistant or non-resistant and which antibiotic is working properly. But that's taken a few days and you don't want to wait. You want to treat as soon as possible. So some advice and some of your experience with certain antibiotics can help you to decide what to use. And at the same time, you can help to fight off the infection of the fish with a functional food like Dr. Bassleer Biofish Food, grapefruit seed extract Poringo that helps the fish during bacterial infections. My books help you to understand fish diseases and train yourself in fish doctoring at my Patreon channel. So I hope this video helped you a little bit understand this complex issue of bacterial infection and maybe Sporozoa infection in the silver shark. Do examination with a microscope. It teaches you lessons. Thank you for watching.